Hey everybody, it is me, Corrie Sommers, and today I'm here visiting a special doctor in Beverly Hills, Dr. Moretz, aka Dr. Mac. So stay tuned, we're going to get into his practice and all the wonderful things he's doing here.
Fabulous, look forward to it.
So Dr. Mac, I found you on Instagram,
Yes.
much like I'm making a lot of really amazing connections these days, and I see that you deal with the skin. And so I don't want to get too far ahead of myself. I want you to explain to everybody what your business is and what exactly you're doing with skin over here, because it's special.
All right, yeah, very special. We have a lot of things that we're utilizing, both traditional, old school things, whether it be surgical, lasers, chemical peels, but also newer, more advanced biologic therapies that involve everything from amniotic membrane to stem cells to exosomes to biologic growth fluids. All of these things, some are applied, some are injected. Many different ways to utilize the biology and cell medicine these days, especially to enhance skin quality and actually sort of like a little gecko or a starfish growing back a limb or a tail, regenerate into a younger form what is now old and saggy, but we don't talk about that.
Well, and I think that's what caught my eyes is the stem cell, this regeneration, that you're just doing some different things. I mean, I've worked with a facialist for years, and I try to be as natural as possible.
Yes.
Thank you. Right. But I also am very mindful, like, as I'm aging and as we're aging, I want to be as youthful as possible, right? And so anything that's on the natural side or stem cell research seems very intriguing. So if someone comes in to see you, how do you decide what's best for them? And what are you normally lean? Is there like a certain protocol? Is it depending on them?
Well, I think like most medicine warriors, you got to have a lot of arrows within your quiver. So, if you only have a hammer, everything looks like a nail. So that's why I really enjoy sort of combination therapies, where I can layer surgical and minimally invasive and micro-invasive and non-invasive all on the individual. So it's really looking at the individual and assessing their structural as well as age-related needs. So you're looking at the deeper layer, such as, say, volume aspects of fat, volume aspects of collagen in the skin, so things may have deflated and fallen. The skin may have deteriorated in age. We're in California, so there's a lot of Malibu Barbies out here and Kens that have a lot of collagen damage over the years, as well as there's just time and toxins, alcohol, tobacco, and firearms all go into what deteriorates our skin. And so you have to look like the movies at 3D. You got descent, deflation, and deterioration. So when you come to deterioration, which is more the epidermal, dermal aspects, you can't really surgery those other than excision and removal. You need to regenerate and renew those, and those are some of the skincare items we have, the biologic therapies, again, stem cells, amnion, all these sort of things, growth factors that can be utilized to do a reverse. So the biologic therapies are what really enhance the ability to complete the picture. Everyone likes a good ice cream sundae. You love the ice cream, you love the fudge, but that whipped cream and that cherry on top just makes it, and a few little sprinkles and a couple of little nuts and stuff on top there too. So when you're looking at a nice individual's volume, from whether it be fat or filler, or you're looking at their surgical lift results or whatever, if their skin looks wrinkly, fine, dry, and deteriorated, it's just not the complete picture.
Okay. Well, I think that's pretty very interesting, obviously, talking about some of the different ways to maintain. Something that a question that popped in my mind when you were just saying that is, so for some people, they might have scarring, like acne scarring. Like I know I have like a very deep groove because I struggled with that in junior high, and a dermatologist took a big thing and just popped, and stuff spread out, and it was like crazy.
Yep.
I was not very happy. But as I've been aging too, like one of my parents has amazing skin. She never has acne. My dad has super oily skin, and is getting kind of those aging marks. Like I don't even know how to describe it. So I'm always like looking at my skin, right? So certain things I've been told require more on the surgery side. And so when you're talking surgery, what kind of surgeries are you doing with the skin?
Well, I do head and neck facial surgery, such as facelifts, rhinoplasties, blepharoplasties, pin the ears that are sticking out, go into the chin, take out the wattles, improve the levens down through here, lip lifts. If people are, as they get aged, their line length of line between nose and lips, it elongates, and sometimes you got to lift that area some. So there are numerous places you can stick a scalpel and make things look better. But there's also super invasive surgical aspects that involve micro-invasive things, such as certain microneedling techniques, or more of a injectable radio frequency, like certain RF energy wavelengths that you can use. Special devices called face-tight, AccuTight, neck-tight that go under the skin and on top of the skin and stimulate collagen growth in the skin, as well as tighten those little networks, what's called the fibroseptal network, that goes from your skin down to your muscles, so that some of that sagging can be lifted back up and the skin made more toned and tight and through there. That's real minimally invasive.
And that's super interesting. It's amazing what technology has allowed us to come and do.
Mm-hmm. Yeah, and so see, even some of the acne scars, some of the irregularities and things like that can be improved by that, because there's a lot of collagen loss that goes on in the skin with various scarring from acne-form lesions or from bad liposuction on the body, things of this nature. So this helps to smooth. So this just helps to sort of smooth things out and create a more just sort of perfect canvas within the picture.
That's amazing. Now, how did you get started in the business of skin?
I've been, initially, I was always doing cosmetic surgical aspects of things, but I also did a lot of head and neck cancer treatments. I did a lot of micro ear surgery and phonosurgery for voice and things like that, professional voices and things of that aspect back in Atlanta, where I had my practice for almost 20 years before moving out here. My family was involved, not my family as such, me, but my kids were involved in the entertainment industry, and they were living out here for several years, and it was like, I need to see a little more of them,
right.
And so I needed to get within the same state, at least, in the same area of Beverly Hills, so that worked out just perfectly.
Okay. Let me ask you this, because I've been to Atlanta and I think it's amazing. I love it. Reminds me of LA in certain ways. You know, got some bad traffic sometimes, but there's a big difference in humidity. So now that you're here in a drier climate, which do you prefer, and what's better for your skin?
Well, different answers for two questions. Okay. By far, I prefer LA. I love Atlanta in many aspects. I do enjoy, obviously, the weather. I do enjoy the entrepreneurial aspects and lifestyle and encouraging people for business ventures here in LA. The weather, by far, if you want to be the best, live in the Amazon. You're going to be 100% humidity. You're never going to get dried out and sun damaged, because you got a big canopy of triple thick density over you, so the ultraviolets aren't going to get through. This is a very harsh environment, both from a direct sun reflection, direct sun exposure, as well as you're walking down the street, you're getting reflective light off the windows in the picture windows, you're getting it off the water at the beach, you're getting a lot of reflective not radio frequency, but ultraviolet damage. So this is and then the drying effects, you were 100% correct there. The drying effects of the diminished humidity, typically either single digit or maybe into the 20s or so here, is much worse for your skin long term than if you were in the South at 40 to 70% on a more routine year-round basis.
That's really interesting, because for me, I always felt like the humidity, I don't know, was worse for my skin. But it's interesting, because I guess being younger when I lived on the East Coast, that's where there was a lot of oil production, and it was like I was always wiping my face down, whereas here it was like wasn't as much.
Exactly. Maybe some of the diet aspects too of the South, some of the fried, fatty, greasy foods and things too, along with your youthful time frame and the quality of oil production at that time.
Well, I really want to thank you, Dr. Mac, for taking the time to talk with me. I know your schedule is crazy busy. We've been kind of trying to do this for the last couple of weeks. If someone wanted to schedule an appointment with you, how does that normally go? Do they come in for consultation? Do they contact your office? What's the best way to go about that?
Well, in this day of social media and electronic communications, obviously the best thing is to come in and be face-to-face like we are today. Right. And they can do that either through my website, doctormacmoretz.com, and or also my other website that links into there, faceofbeverlyhills.com. They can reach out through me through social media, Instagram, Facebook, LinkedIn, all those things. I guess Twitter's out there too, though I don't hardly know what that one is.
Right. We'll have all of that below, so don't worry, guys.
Exactly. And then I can do either in-person consultations or a lot of out-of-town or European or Asian. I do a lot in China. Okay. Individuals, we do Skype consults or WeChat or WhatsApp. It just depends. So a lot of people come in off of the internet-based platform consultation, all pre-cleared, pre-certified, bring in their labs and exams. I then do a pre-surgery actual in-person evaluation, but then we go into surgery the next day.
Okay.
So that's an option too.
So super efficient.
Yeah.
Love it. All right. Well, everybody, again, all information is below. Dr. Mac's amazing. So doing a lot of very cutting edge stuff over here. So if your skin and you're just struggling with it, or maybe you've, like me, just had work with a facialist and you just need something extra, I really recommend you check him out. Come in, at the very least, talk with him, see if he can help you out, and I think you'll be surprised at the results.
Look forward to it.
Thanks, guys. If you haven't already subscribed to my channel, go ahead and subscribe below, click the bell, and we'll see you next time.
Please do. Please do.